We continue to take a look at the fallout from Roe v. Wade being overturned by the Supreme Court. At least 13 states have ceased nearly all abortion services. Next week, voters in Kansas will decide whether or not to protect their right to abortion in the state's constitution. It's the first time abortion will be on the ballot since the landmark Supreme Court ruling. And as more states move to restrict abortions, one doctor who does not live in this country is now poised to become one of the most controversial abortion providers in America. Joining us now is Dr. Rebecca Gomperts from the Netherlands, whose organization Aid Access is providing telehealth abortion pill appointments in at least 19 states. Doctor, thank you so much for your time and joining us tonight here on Prime. You've been working for more than 2 decades at this point to help women in countries who can't easily access abortions. Now the U.S. has been added to that list. How much demand have you seen grow since that ruling a little more than a month ago?
Thank you so much, Linsey, for having me. Aid Access is actually serving all 50 states. There's 9 providers from the United States that joined Aid Access who are serving states like New York, California, Washington, etc. So what we've seen, actually, it started when Texas introduced its ban to abortion in September. After this, we saw an increase of 1,100% of requests from Texas.
And some states, as you know, are moving to try to ban access to abortion pills like the ones that your organization is sending out. At this time, how many states are women able to effectively access the services that you provide? I know you said that you have it available to 50 states, but I'm presuming, are pills not yet part of that discussion? And are you able to legally offer that in states that currently ban abortion?
Yes, so Aid Access is able to offer the telemedical service to women in all the states. And how it works is that in the states where, like New York and California, it's the U.S. providers that are providing the prescriptions for the women have done the telemedical service consultation, and that prescription is filled by a U.S.-based online pharmacy. The other states, these women are referred to me, and I'm licensed to practice in Austria, for where I'm prescribing the medication to the women that need help. And the prescription is filled by a pharmacy in India, and then it's sent to the women that need it.
So is that effectively the loophole because it's not coming through an American doctor in their state?
Yes. So I am complying with all the laws and regulations and all the medical ethical guidelines of the countries where I'm registered to practice.
How would officials be able to stop pills from being sent overseas? How are the packages labeled?
So I've been working in this field for now over 20 years. Another organization that I founded called Women on Web has been a telemedical abortion service as well that is serving the rest of the countries around the world, has been working like this for over 17 years. And so basically, that is what I think is very different from 50 years ago when Roe versus Wade was put in place. There's abortion pills. This is a revolution for women. Women can do their own abortion with the abortion pills. It's safe to use, according to the World Health Organization, up till 12 weeks of pregnancy. It's safer than Viagra or over-the-counter painkillers. And I think that's very important that women know that they can take this medication safely at home by themselves.
So women ultimately wouldn't have to, for the most part, go to a hospital at all or suffer any kind of aftermath from this at all. This can all be contained to their home.
Yes, and actually that is how it's taking place in many other countries, for example. And actually it's something that's allowed by the FDA. Telemedical home abortion has been approved by the FDA in December last year after COVID. This was the standard care. So that it's a standard care.
In the past, we know that you've used robots and drones to help deliver pills. Is this something that you think could be done here ultimately in the United States?
Well, I mean, yes, I think it will be very important to also start campaigning. At this moment, though, I think it's most important for all the abortion rights people to work together to make sure that the people that don't live in the states where abortion is now banned, that they will have access to safe services, and that we put everything together to make sure that these women and these people that have an unwanted pregnancy will be able to access the care that is their human rights.
And doctor, just curious, how do you respond to critics who say that you're killing babies, that you're taking these lives?
So I am, a woman is my patient, and I am caring about this woman's life and about her health. The reality is in the United States, actually the maternal mortality, which means women dying while giving birth, it's extremely high. It's 4 times as high, for example, than in European countries. 1 in 5,000 women die from giving birth. An abortion with pills is so much more safer. It's 60 times safer. There is a risk of less than 1 in 500,000 that a woman could possibly die from that. And I think that this is the safest medical treatment that exists. And women have the right to have access to this life-saving medical treatment.
Dr. Rebecca Gomperts, we thank you so much for your time tonight. Really appreciate you joining the show.
Thank you so much for your invitation.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.